Try standing on one leg, and you'll quickly discover that balance is much more than strength. Your brain must constantly monitor your position and make rapid corrections to keep you upright. But there is an important safety rule before you begin. If you already feel unsteady, dizzy, or at risk of falling, do not attempt a challenging balance test alone. Stay next to a sturdy support. Keep the area clear and stop immediately if you feel unsafe. The goal is to understand your balance, not to prove anything won. What this test is really challenging, the real challenge isn't simply standing on one leg. You're asking your body to maintain a stable position, while your brain continuously processes information and coordinates small corrections. Your vision, inner ear, feet, joints, muscles, and nervous system all contribute to this process. That's why the same test can feel completely different from simply standing normally, and importantly, your result should be treated as an observation, not a diagnosis. If you notice a significant or persistent change in your balance, especially if it comes with dizziness, fainting, repeated falls, or other symptoms, that's a reason to discuss it with a healthcare professional, rather than trying to diagnose yourself from a home test. So the goal isn't to eliminate every movement. When you try the test, don't expect your body to remain perfectly frozen. Your body will naturally make small adjustments. The real goal is controlled stability. Your brain detects small changes, your sensory systems provide information, and your muscles respond to help keep you upright. That process is happening continuously, so instead of asking, "Can I stand perfectly still?" ask a better question, "Can I safely control my position and respond to small changes?" That is much closer to what balance actually involves. 3. Your brain is constantly receiving information. Every time you stand, your brain is receiving information about what your body is doing. Your eyes provide information about your surroundings. Your inner ear contributes information about movement and orientation. Your feet, muscles, and joints provide sensory information about your body's position and contact with the ground. Your brain combines these signals and helps coordinate your response. You don't normally have to think about any of this. If your body shifts slightly forward, you don't consciously calculate which muscles should contract. Your nervous system helps make the necessary adjustments automatically. That is one reason. Balance is more complicated than simply having strong legs. When you stand on one leg, the demand becomes greater. Your base of support becomes smaller, so small changes in your position can become more noticeable. This is also why your performance can change depending on the situation. Fatigue, illness, footwear, vision, medications, and the surface you're standing on can all influence how steady you feel. So if the test feels difficult, don't immediately conclude that you are bad at balance. Instead, recognize that you're challenging a complex system that has to process and respond to information continuously. 4. Those tiny corrections are the real work. When you stand still, your body is not actually motionless. There are tiny shifts happening all the time. Your body moves slightly. Your nervous system detects the change, and your muscles make small adjustments to help bring you back toward a stable position. Then another small movement happens and the process repeats. You may notice this more clearly when standing on one leg. Your ankle might move slightly. Your hip may shift, your upper body may make a small adjustment. Those movements are not necessarily signs that the test is going badly. They are part of how normal balance works. The important question is whether your body can safely control those movements. Think about it like making small steering corrections while driving. You don't need to turn the wheel dramatically every few seconds. Small adjustments are enough to keep the vehicle moving in the intended direction. Your nervous system uses a similar principle when maintaining posture. As we age, changes in muscle strength, sensation, vision, reaction time, or other health factors can affect balance. That doesn't mean every balance change is simply normal aging. And it certainly doesn't mean that a difficult test predicts a future fall. It means balance is worth paying attention to. If you notice a persistent or sudden change from your usual ability, especially if you also experience dizziness, fainting, repeated falls, or significant unsteadiness, it's better to seek professional evaluation than to rely on a home test for an explanation. 5. Your feet are part of the system. Your feet do much more than hold you up. They provide sensory information that helps your nervous system understand pressure, movement, and position when your weight shifts during the test. The pressure beneath your supporting foot changes. Your nervous system can detect these changes and help coordinate adjustments through your ankle. 16. Why recovery matters for balance. Balance can also be affected by something as simple as fatigue. When you're tired, your muscles may not respond in exactly the same way, and maintaining a demanding position can become more difficult. That's why you shouldn't judge your overall balance based on a single attempt after a poor night's sleep, a long day, or when you're feeling unwell. Instead, think about your balance as part of your overall physical function. Regular movement, adequate recovery, and appropriate exercise can all support your ability to stay active. The goal is consistency, not exhausting yourself with difficult balance challenges. Nodsese. Pay attention to changes you can feel. One of the most useful things you can do is become familiar with your normal movement. Maybe you usually feel comfortable walking across your home, but recently you've started reaching for furniture. Maybe turning around suddenly feels less stable. Maybe stairs require more concentration than they used to. These changes don't automatically mean something serious is happening, but a persistent change in balance is worth paying attention to. Instead of ignoring it or trying to diagnose yourself with an online test, consider discussing it with a healthcare professional. Sometimes, the most valuable information isn't a number from a balance test. It's noticing that your normal movement has changed. 18. Balance training should be appropriate for you. If you want to work on your balance, don't immediately choose the hardest exercise you can find. Start with movements that match your current ability. A sturdy countertop railing or other stable support can provide something to hold on to while you practice appropriate exercises. As your control improves, a qualified professional can help you determine whether and how to progress. Balance training should challenge you without creating an unnecessary fall risk. And remember that balance exercises are only one part of physical fitness. Strength, mobility, endurance, and regular physical activity all contribute to maintaining function as you age. The best program is one you can perform safely and consistently. 19. The most important test is your everyday life. Ultimately, the purpose of a balance test isn't to chase a perfect score. What matters is whether you can continue doing the things that are important to you. Can you walk safely around your home? Can you get up from a chair? Can you navigate stairs? Can you step over an obstacle? Can you turn and change direction without feeling dangerously unstable? These everyday movements require your brain and body to coordinate continuously, so use the balance test as a reminder, not a verdict. Pay attention to your movement. Respect changes, practice safely, and ask for professional guidance when something doesn't feel right. The goal isn't simply to stand on one leg longer. It's to keep your body capable of responding to the small challenges of everyday life.